My name is Rayford Scott Jones. I'm the Emeritus Professor and Chairman of the Department of Surgery at the University of Virginia. I first want to acknowledge that the work on this project was done by my several colleagues, but in particular I want to acknowledge Dr. Katie Marsh, who is the first author. Errors occurring during surgical care can harm patients by contributing to adverse events and mortality. Errors have not been studied extensively. For that reason, we conducted a case-controlled study to examine errors in surgical care. This study revealed errors in judgment harm patients more commonly and more seriously than other types of errors. We then conducted a subset study on the patients with judgment errors to test the hypothesis that preoperative variables can be associated with judgment errors. The American College of Surgeons National Surgical Quality Improvement Program produced from a single institution were examined. Medical errors were reviewed and evaluated for judgment errors. Of the surgical patients who experienced morbidity or mortality, 18%, or 31 out of 170, experienced an error in judgment during their hospitalization. Patients with hepatobiliary procedures, insulin-dependent diabetes, severe chronic obstructive pulmonary disease, or with infected wounds were at increased risk for judgment errors. The results supported the hypothesis that preoperative variables can be associated with judgment errors in surgical care. The most common judgment error was inappropriate operation, which could occur preoperatively or intraoperatively. Sometimes errors in judgment are obvious. However, most judgment errors are not as clear. Among multiple surgeons, each may recommend different management for any given case. Judgment errors during surgical care deserve careful study because preventing judgment errors can reduce postoperative morbidity and mortality.